have, none of that was discussed.
Well, tell me about some of the experiences that you've had in the healthcare system. What have you seen?
Well, I've worked in a large healthcare organization in Virginia for 12 years, and the Physicians Network, usually the physicians are told to see patients and so many patients in 15-minute increments, and they're pushed in, pushed out, pushed in, pushed out. You don't get good detailed health care. You get fast, let's get them through, get them out, what's bothering you, we go straight to that. And health care is just not, it's not what it should be. So the new plan, how is it going to be focused?
We're now watching some video from earlier at the healthcare town hall in Reston, Virginia. And just about 6 minutes from now, we're going to see Alaska Senator Lisa Murkowski's town hall in Anchorage, Alaska. Chris, you're next, a New Jersey resident. Hi there.
Hi, how are you? I just want to start off by saying I'm a young Republican, and I'm really concerned about this health care bill. First of all, I understand how this will all be paid for. They never make that clear. As a young adult in America, my Social Security is already going to be limited. And I think the real problem here is one questioner mentioned was the need for tort reform. They need to realize that if we capped lawsuits at $250,000, it would save the government over $80 billion. And because really, who cares about annoying the trial lawyers when it's really about the American people? You can't just, try and work with a very select few who are going to profit off of this.
Well, let me ask you, what do you think about competition in the healthcare system? Is there enough now? Do you think that we need more in the healthcare system in the U.S.?
No, I think competition where it is great. Doesn't need to be expanded or decreased, but keeping the government away from it is where I think we need to go with it.
Sorry for cutting you off. Ivan from Connecticut. Go ahead.
Yeah. I have a couple of things to say about the fact that these politicians are fooling the mass majority of people, and it's not working on the intellects of America, which is a very small percentage. And I'd like to also mention that if they wanted to fix all of these debt problems, they should get rid of the Federal Reserve System that owns the country. They make every single dollar and print it out and expect profit back, but they're the only people that print the money. It's absolutely ridiculous that we can get 300 million people to abide by these laws that are word magic to people who don't even know the system. They don't know enough about the world to have an opinion. And just the fact that they have an opinion, my opinion is you can't be serious about this because we're all going downhill, and we're going to drag every single one of us by holding on to each other's collars, and it's going to go down. It's going to go down. There's going to be some sort of revolution or something's going to happen, and it's not going to be pretty. We need to focus on the bigger problems, and Medicare is not it. So there was a gentleman who was speaking before me talking about the masters of industry and all of the secret people beyond the government that have all the say. They pay no taxes, and they make all the money. They're the richest people in the world. There's 5% that makes up how rich this country is. That is not right.
A Democratic caller from Tennessee, Betsy?
Yes, Betsy Cannon. Look, I'm calling because I wonder if the general public, the people who are anti this health care bill, understand about competition in healthcare. I'm a healthcare provider, okay? Understand that those things that they're complaining about control is already in place. If the government can't be in control, what we have now is the insurance companies in control. I don't know one physician that could honestly say that they make their decisions simply based on the patient's condition. Those decisions are influenced by the payers or the facility that they're working in. So all the things that people are complaining about, or most of the things, are already in place. It's just not necessarily in their benefit.
Our last call tonight is from Karen from California.
How you doing? My name's Karen. You know, I watched this tonight. I'm a recently new Republican, Democrat all my life. And I watched, and I've been to town hall meetings here in California, Republican ones, because my U.S. senators won't hold them. And what I saw tonight, I was kind of appalled, because being a Democrat all my life and now changing to Republican recently, I saw pre-screened questions that I've never seen. My congressman answered questions just in the audience, you know, just out of the blue. And I saw this representative want to throw a whole group of people out until he found out that it was just one person. I saw this representative want to back a bill by a person in my own state, our Representative Nancy Pelosi. I heard him say at a last call. I heard him not answer questions. I heard him call up and have, you know, Dr. Dean come up. Well, Dr. Dean is not a person in Congress. He's not the one that's going to be voting an extra vote that actually is going to help. It's going to affect me personally, seriously. So, you know, what I saw tonight was, and then I saw something, you know, free speech is something that we all fight for. I saw that. And then my mom. I see my mom's Social Security checks not being increased for the next 2 years. I mean, how can people not see things disappear underneath their nose? And you know what? I'm completely appalled by what I saw in this town hall tonight. I saw people want to be thrown out. I saw pre-screened questions that I thought I would never see in my lifetime from a Democratic Party that I was a member of for a long time, that I just recently changed to Republican, and then I'm very proud of thank you very much to be a Republican at this point in time from what I saw on C-SPAN tonight, because you know what? This congressman needed to answer those questions and not call another person up to answer those questions for his constituents who are voting for him, actually. So, but thank you for taking my call, and I love C-SPAN, by the way.
That was our last call of the night from Karen in California. And C-SPAN will continue to cover these healthcare town hall meetings. If you're attending one in your community, we want to hear from you. Tell us about a proposal, your ideas about the healthcare legislation on video. Go to cspan.org/citizenvideo. Members of Congress have been holding meetings with constituents in their districts over the summer recess. We just saw one with Congressman Jim Moran. Up next, Alaska Senator Lisa Murkowski takes questions at a high school in Anchorage. That's next. After that, an update on Afghanistan's election.
Healthcare Hub is a key resource. Go online, follow the latest tweets, video ads, and links. Watch the latest events, including town hall meetings, and share your thoughts on the issue with your own citizen video, including video from any town halls you've gone to. And there's more at cspan.org/healthcare.
Now that town hall meeting from Lisa Murkowski, Alaska's Republican senator. This is from A.J. Diamond High School in Anchorage, Alaska. It's about 2 hours.
I recognize that outside we have a beautiful Alaska summer day, and you all have chosen to give 2 hours of your evening to be here, to offer your comments, to share your concerns, your suggestions, your fears. And I thank you for doing this. I can only represent you well in Washington, D.C. when I feel I know well what it is that you are looking for, what you are seeking. So this town hall meeting tonight, as we discuss healthcare reform, healthcare issues, healthcare insurance, it's important for you to be here, but it's equally important, it's much more important for me to be here to listen to you. As much as I would love to stand here and spend the next 2 hours telling you about everything that's in the Help Committee bill or not in the House bill, we can do that at another time. What I'd like tonight is to hear your comments. So I'm going to have to put a leash on myself because I have a tendency to want to tell you everything that's in it. And if I do that, I'm not going to be hearing as much from you. So Dennis has given you the ground rules in terms of how much time we'd like you to spend in terms of your comments or your questions. I'm going to try to exercise a little restraint here, but give you the information that I believe you're seeking. I do want to thank you not only for your presence here tonight, but for the comments that I have received from Alaskans all over the state these past few months this summer. I've probably received over 5,000 emails, handwritten letters, phone calls, and so many of you have expressed a great deal of concern with rushing healthcare reform through Congress. At one point in time, the President had said, you know, I want to have a bill to sign before the 15th of October, set a deadline there. I've heard from many of you who are very concerned about the massive spending by our federal government. It's putting debt on our children and our grandchildren's generation, future generations at risk of trillions of dollars in federal debt. And many of you may not have an opinion on the government plan, but you're concerned about the costs of your premiums, seeing double-digit increases every year, and want to know, so what's this bill going to do to help reduce that? How is this going to help me? How am I going to be able to keep the insurance that I have? I've also heard from many who support the actions that have already been taken by Congress, and that the President is supporting. So wherever you're coming from tonight, I really want to hear from you. Even those of you who may say, Lisa's coming at this from a completely different perspective, I need to hear that voice. But I think we need to be respectful about how we deliver those opinions. I hope that everyone has received a copy of the materials that were presented to you. It's a packet of information that I want to take just a minute with you tonight before we go to your questions, because I think these will provide you with a little bit of a background in terms of where I'm coming from and how I have formed my position on some of these issues. The first picture there, the first graph, shows the exponential growth that we face in healthcare costs. And the President has stated it. I think every member of Congress has stated it. The growth curve is not sustainable when we talk about our health care costs. And part of the reason for this is, quite honestly, people are living longer. Our technology allows for that. But I think also we recognize that much of this is unnecessary costs. We've got duplication of tests. We've got the practice of defensive medicine. And we have, certainly here in Alaska, we've got a lack of primary care, which results in perhaps greater utilization of specialty care. So in order to understand why our premiums are rising so much every year, we need to look at how we're spending money on health care. And we've gone from $250 billion in the early 1970s to over $2 trillion in the mid-2000s, and this is in inflation-adjusted dollars. I said it before, I will repeat, our health care costs are on an unsustainable path, and they have to be addressed in whatever health care reform legislation we pursue. The second graph on the bottom of the first page is the Medicare cost growth projections, and this includes the historical Medicare costs back to 1985. It shows how much the CBO is the Congressional Budget Office, and this is the nonpartisan budget office. This is how much they predict Medicare costs will grow without any policy changes over the next 50 years or so. So you look at that. The increase is astronomical. The curved line at the bottom indicates the net balance of Medicare's trust fund at the end of every year. And if you look, in 2018, that trust fund balance goes to zero. So we've got a system with Medicare that, quite honestly, is also unsustainable. It's broken. Moving to the back of that page, this is the federal spending list. And the reason I have put this here is as I have traveled across the state and as I've talked to people about what's going on with health care, oftentimes what I'm finding is it's not so much that I don't like what you have in the health care bill or I do like what you have in the health care bill. There's a great deal of emotion about where our federal government is going and what are you guys in Washington, D.C. doing anyway? And when you put it into context in terms of our federal spending and the national debt, you look at it and it's unprecedented what we have seen in the past. It's just basically been about 19 months when we've spent over $3 trillion. You say, well, how can you possibly spend it? But when you think about the first stimulus that we had back last February, the stimulus that we had just in January at $787 billion, we bailed out Fannie and Freddie and AIG. We had the TARP funds at $700 billion. You've got, throw in a couple $1 billion for cash for clunkers that we just did several weeks back. And then we say back in Congress, well, we're talking about a health care proposal that could be in excess of $1 trillion. And all of a sudden people are like, whoa, wait a minute. $1 trillion on top of everything else that you're spending? Tell me that you're going to get it right. Tell me that you know that this is going to work. And oh, by the way, we can also talk that we're dealing with climate change legislation. We don't know how much that's going to cost us. So I put this in as one of the slides just to kind of put into context what we're dealing with in terms of federal spending. Our budget deficit is predicted to be close to $1.8 trillion at the end of this fiscal year. So it is substantial. It's out of control. CBO, on the bottom half of the page here, is the neutral government scorekeeper. This is who we rely on in Congress to assess, to analyze the legislation that we have in front of us in terms of what it would cost. And they've made the comments that you have before us about the health care bills before the Congress. I won't read them. I'll let you do it because I want to get through these slides. The next one speaks to the needs and why we are talking so much about increasing access to health care and to better understand who we're talking about when we define the number of uninsureds. We have identified about 47 million people in this country that are uninsured. But if you look at the pie chart, you'll see that, in fact, there are some categories there that those that earn more than $75,000, about 19%, but who choose not to purchase health care. You have those that are eligible for government programs such as SCHIP or Medicaid, but are not enrolled. Then you have those that are eligible for employer-sponsored plans, but for whatever reason have not chosen. So what we're talking about, those that are without affordable insurance options is around $12 to $13 million. I think it helps to put a little bit of that in perspective. You then have some comments from ICER, the Institute of Social and Economic Research here in Anchorage, that speaks to some of the issues that we face here in the state of Alaska when it comes to access for those who are Medicare beneficiaries. We've got a situation here in Anchorage, the largest city in the state, where you've got only 13 out of 75 doctors who will see new Medicare beneficiaries. This is an issue that without discussion comes to me more often than any when I'm talking to people about health care. They tell me, my mother can't get in to see a doctor. I don't know where to go. I brought my parents up from outside. I can't get a doctor for them. At the health care meeting that we had in Fairbanks last week, I had a woman stand up and tell me that her mother, who is on Medicare, has a great doctor there in Fairbanks, but this woman is talking about moving down to Anchorage, and her doctor in Fairbanks said, don't do it, you won't be able to get a doctor to see your mother. This, folks, is a huge, huge problem for us when we talk about access. The next slide on the back there discusses the issue as it relates to Medicaid and Medicaid costs. The projections that are derived from the National Governors Association indicate that here in the state of Alaska, we spend about $1 billion on Medicaid currently. Now, under the Senate proposal, if we pass that version, Medicaid would be expanded. The cost to the state would be somewhere between $90 million every year and $130 million every year, depending on how much the federal expansion would be. This would be a cost that is passed straight on to the state. Now, there have been discussions that, well, on the federal end, the feds would pick it up for, under the House bill, 2 years, under the Senate bill, 5 years. But ultimately, it comes back to the state, and it is a state expense. And it's something that, again, we need to keep in context. The last slide there is some thoughts about how I believe we can advance a health care reform. We must have a system that guarantees insurance coverage to those with pre-existing conditions, whether it be diabetes or heart disease or mental illness or for rare genetic conditions. We must deal with this. We must ban insurance companies from denying claims or canceling coverage because of newly detected health conditions. We have to ensure that those who like their health insurance can truly keep it. We have to guarantee that the health decisions that are made by you and your doctor are made by you and your doctor, and not the insurance company and not the federal government. We need to make sure that we're equitably reimbursing our providers for the care that they're providing for you and your family. We need to prohibit financing health care reform on the backs of our small businesses. Here in the state of Alaska, 96.8% of all of our businesses are small businesses. Imposing an employer mandate is, in my opinion, a very difficult burden to impose on our small businesses. We must prevent the insurance companies from placing the financial limitations on caps on how much they're going to pay for your treatment. And then, absolutely, we must focus on the prevention and the wellness aspect, those that will reward and facilitate healthy behaviors and lifestyle changes. What I can't support are measures that are going to create a government program that will shift millions of Americans from private to a government coverage and ultimately eliminate the private insurance system as we know it. The President has stated that the status quo in healthcare is unsustainable, and I think if you look at the first page of your handout, you will see and you will agree with that. But we must recognize that building healthcare reform on the back of a broken Medicare system is also unacceptable. We need that structural reform that moves us away from fee-for-services, away from paying for quantity as opposed to quality. We have a great deal of work to do in Washington, D.C. I do believe that it is achievable. I do believe it is absolutely necessary and imperative for your Congress to address healthcare reform that gives us a system that we are proud of, but that also gives us a government that is affordable. So with that, I would like to open it up for questions. I think that Dennis has laid out the ground rules. We've got microphones, and he will be calling on you, so I'm not playing favorites with anybody, but thank you for your attention for right now.
Two more comments is that when we ask someone to speak and they maybe don't get everything they want to have said, all of you should have picked up one of these cards at the front, and you please give us your comments on your cards. And those of you that choose not to speak publicly, please give us your comments on your card or visit the senator on the internet and email her. The one other housekeeping item is this particular brochure that the Senator was just going through is the only one sanctioned by Senator Murkowski. There were other materials passed out before the meeting, which is fine, but those were not her materials. Those were of different groups. Thank you. Yes, ma'am. Just stand up. As soon as I sit down, your time starts. Excuse me?
Identify themselves.
Oh, yeah, please tell us your name and then the time starts.
Okay, my name is Joanne, and my question is, you're talking here about the bureaucrats that are going to be making the decisions. How are those bureaucrats going to be chosen? Are they going to be chosen by us, the people? Are they going to be chosen by the president? Are they going to be chosen by Congress? Are they going to be representative of all the 50 states? Are they going to be part of somebody from each ethnic group? How is this going to happen? How is it going to affect us? What say are we going to have?
It's an excellent question, and I think it's one that anyone who cares about their health care for themselves or their family should be asking. I will speak to what we have laid out in the Senate bill, and when I speak about the Senate bill, one caveat: there is a bill that moved through the Senate Health, Education, Labor, Pensions Committee. That's a committee that I sit on. It passed out of committee about a month ago. There is another Senate version that is being crafted or worked on within the Senate Finance Committee by a few core individuals. There is nothing of detail yet. The House has its own version of health care reform legislation. But let me just speak to the Senate version, because I spent about 60 hours with other members of the committee going through that proposed legislation. You would have basically for lack of a better term, a medical board, if you will, that would be composed of individuals that would be selected by the Secretary of Health and Social Services. I do not believe that there is the president has any oversight over the selection of who might be on the medical panel. So it is through the Secretary. There is a great deal that is, I guess, co-signed to the Secretary of Health and Social Services in terms of the directives and how individuals are appointed or how decisions are made. Again, it goes back to my comments that if it's me and my health care that we're talking about, I want to know that it's me and my doctor who are talking about it, or if I need to have other family members in as consult, in on the consult, that's where it is. Quite honestly, I don't think that having a group of nameless, faceless individuals that are telling my doctor what he should be doing for my health care is where I want to be.
The gentleman with the glasses about the fifth row back. Yes, sir. That's you. Please introduce yourself.
Senator Murkowski, my name's Darrell Kiefer. Would you support a public option if it saved the overall economy in the long run? What I mean by that, it would increase, the $100 billion a year of federal increase, but it would save the economy. And what I mean is there's now a hidden tax on insured people. And I believe that's about $1,900 for each insured worker in Alaska. And so both my wife and I work, so we're paying an amount for the uninsured, through emergency room care and things. That's rivals our income taxes, about $3,800 between the two of us. Also, about 50% of our bankruptcies and 62% of our foreclosures, those are costs to society, and they're due to medical bills. So if we took the long run and looked at the overall economy, would you then support a public option?
I've been asked many times, you know, will you support a public option, a government-run plan? And what I remind people is, you know, it's not so much that the government-run plan is in and of itself a bad thing. We have government-run health care right now with Medicare and Medicaid and the VA system and the IHS system. We have it. So I am not so afraid to say we cannot absolutely positively not have a government-run plan. But what we have to have is a government plan that actually works. And let me tell you, to take the model of a broken system, a system that does not work, and in the state of Alaska, Medicare right now does not work. If you cannot get in to see a provider, it does not work. So if we're going to move towards any kind of a government-run plan, the devil is clearly going to be in the details. If you can't get in to see a provider, all we're doing with that government plan is giving you a new card. Somebody described it as giving somebody a bus ticket knowing full well that there's no bus. Well, that's wrong. And we got to fix that. So I'm not afraid of just saying no to a government plan.
Okay, let's go back a little bit to the gentleman in the brown shirt, about halfway back on the right.
Thank you, Senator.
Please introduce yourself.
My name is Ray, and I'm one of your many senior citizens. And I want to tell you this, that you have one of the most precious things from your constituents that neither your fellow senator, nor our president, nor many members of Congress have. That's credibility in our trust. Now, but Senator, believe me when I say that I and many other of my senior citizens here are terrified at what could very well happen to us if this hurriedly and haphazardly written bill is jammed down our throats. Just today I was able to see my doctor. This is unusual even under this situation. I got x-rays, I got an MRI, and it was so comforting to know I'm covered by Medicare and that I didn't have to go through a governmental goat rope and an abnormal waiting period for neither a government panel to tell me whether I can have it or not. So they can say no, or yes, or wait like in so many other countries. So just a few notes here. Bottom line, and my question to you is this, because I can't believe the smoke and mirrors and the bait and switch signals that are coming from the White House, is how can you add 40 to 50 million persons under Medicare, cut $500 billion, as I understand it, from the program, without rationing or denying people like me, the elderly, any of these other services that we're going to need. It sounds like they're going to be doing a lot of rationing, denying, and deferring. Medicare, as you say, does need fixed, but much of it works right now, and you mentioned what needs fixed. Why throw the baby out with the bathwater? Why don't we take small bites and cure what's wrong? Thank you.
Well, I appreciate the comments, and what you have expressed is what I have heard from so many. Why throw the baby out with the bathwater? Well, I will tell you, and it goes back to my comments to the last gentleman. We've got a system here in Alaska that is failing our seniors if you can't get in to see a provider. Now, you're going to hear me say that many times tonight. I've got to figure out a way where we can address the concerns of Alaskans and people all over the country about rising costs of health care, rising costs of premiums, while at the same time providing you access to a doctor, somebody who can write your prescriptions and heal your body, fix you up, And our reality is right now, we're not doing that. The legislation you've suggested has been rushed through. And I will tell you, we had a process in the Senate Help Committee that was not a good way to run a committee. We had a bill, a 1,000-page plus bill, that was presented to us as committee members for the first time on a Thursday night, and we were basically told, we're going to mark up on this bill on Tuesday morning, have your amendments in over the weekend. And oh, by the way, the section on the government option was not even included in the draft because it had not yet been written. Now, we did spend 4 weeks going through all aspects of the bill, but it was a process that, in fairness, was not a real effort to work through tough issues in a bipartisan way to make a bill better. The pressure on us was to get a bill out of committee yesterday. Well, when you set an arbitrary date for accomplishment of something, and you do not set as your priority advancing good policy, then what you're going to get is something that moves out of committee that is not good policy. I'm not willing to support anything that's not good policy for Alaskans.
Every 3 questions, we are going to be moving out to the group that is not sitting in here so we can make sure we get their voices in the room too. They're sending me in comments. And one that is sort of related, and it has to do with what is your position on the healthcare cooperatives that have been mentioned recently?
It's an excellent question because it's floating out there right now, has been under discussion for about a month or so. I wish that I had more details about it. In fact, I made contact with the Senate Finance Committee just today to say, do you have any more in terms of the nuts and bolts of where you are with the specifics of a co-op? Because people are looking at this as well, is this perhaps a way for us to go? What I was told today is that, in fact, there's still a great deal of discussion about the concept, that it may be something that can advance through this group of 6 that are working and ultimately be presented to us. But right now, it is more just a theory in concept. So I wish that I could share more with you. Now, there are some who have said that we absolutely positively can't go with a co-op. We need to stick with a public option. There are others who have said you can't go with a co-op because a co-op is nothing more than a Trojan horse for the public co-op for the public option plan. So we're going to have a clashing in the middle probably, but right now we don't know what it is. Here in Alaska, we've got familiarity with our rural electric co-ops, and we know how they work. How would that work within the healthcare field? I don't know that we know yet. Is it something that is worthy of discussion? Why shouldn't we talk about it? Why shouldn't we take the time to look at all of the options and all of the issues instead of saying, this is the path that we must take and we must take it by this date. Let's put it out on the table.
The woman back with the blonde hair, blue, about halfway back. Can you turn around, sir? This way, on this side, right there, right in front of you. Right down in front of you. The woman in the blue, there, right there. That lady. Thank you.
Yes, my name is Pamela Mason. I work for a medical billing office. My concern is that we're going to get into the same situation we have with Medicare about the reimbursement rates are so low, which is while the providers can't see Medicare patients, they literally can't stay in business with the amounts that they reimburse. Is the federal government, if we do go for something run by the federal government, are they planning to cap fees and eventually, push doctors out of business, and then will we lose all of our, doctors as a result?
Well, I wish that I could give you something comforting there, but the reality is, and this has been laid out by the director of the CBO, Mr. Mr. Elmendorf. He says, you know, in order for at least the health care plan that was moved through the Health Committee, in order for that to pencil out, the reimbursement rates under a public option would have to be set at Medicare rates in order to work. Well, at one point in time, we were talking about Medicare plus 10%. I met with a group of doctors and I said, well, okay, if we did have this plan and that was the reimbursement rate, what would it mean to you? What would you do? And to a number, they all said, I couldn't do it. I could not do it. And so you not only would have, you would have doctors that are not only opting out of Medicare, but would opt out of the government plan. So whether it's the Senate bill that we're looking at or the House bill that we're looking at, the House bill puts it at Medicare plus 5%. The doctors in Alaska that we're talking with are saying we simply cannot do it. And so, again, we're trying to, the structure that has been built, at least in the Senate Health Committee and on the House side, is one that is built too similar to a system that is not working for a rural state like Alaska and won't work for other rural states. Now, it might be working just fine if you are in Washington, D.C., or in Boston, or in a big urban center, but it's not working for us.
Okay, excuse me, this way. The woman right there has kind of a beigeish, yes, thank you.
Hi, my name is Dr. Ilona Farr. I'm a family practice doc here in town, and I'm here representing 16 family practice docs, which is 20% of the family practice docs in Anchorage. We went from 180 down to 75 family practice doctors because of low Medicare reimbursement rates. Our call group uniformly said that if the bill that is currently proposed, or bills, we would all be out of business by 2014. This is a very serious problem, as we all enjoy seeing our patients. Right now, for a $115 office visit, I am paid $40 by Medicare and $7 by the secondary insurance. United Healthcare takes $400 for secondary insurance a month. They made $3 billion last year. What we need to do is do health savings accounts and allow our seniors to take $300 that they are paying right now to the secondary insurance, put it in a health savings plan so they can pay us, so they can pay for hearing aids, so they can pay for other medical devices without a bunch of government bureaucracy. And people should be allowed from birth to death to do health savings accounts. That's one of the things we need to change. The audit. Right now, we're penalized. They can come in and fine us $20,000 for paying us $43. That is ridiculous, and a reason why several of my colleagues have dropped out of Medicare. There's several other different things that I have that I would like to see. One is business losses for patients that cannot afford the health savings accounts to go to allow us as physicians to write off these losses as business losses. And that none of these things would cost the federal government a penny and would put the control back in the hands of the patients and of the physicians. The other thing that I would like to say is we also need to reform malpractice. That is not addressed in any of these issues. And I've already emailed your
And thank you very much for your comments. You got your 2 minutes. Great. On this side, the gentleman, third
Dennis,
row back.
Before we go, what I want to do is acknowledge you and thank you as a family practice doctor. You are unfortunately almost a dying breed in our state, and what is happening, as you have stated so aptly, is the government is driving those out of the practice. And it's people like those in the room and those that are listening and watching that suffer as a consequence. You've offered some good suggestions, and I thank you for that.
Now, down to the front. Third row back. Yes, sir, you with the glasses. Thank you.
Thank you, Senator. My name's Tom McGrath. I'm a small business owner here in Anchorage. I provide health care for my employees with a copay, so they're invested in the system. The most inefficient part of my company is that of dealing with the government, municipal, state, and federal. Every part of the government that I deal with is inefficient, down to the post office. Why would we want to allow the government to be in charge of health care in the United States when they can't do anything right as it is? Thank you.
Well, Tom, you run a small business. You know what it's like to be in charge and make business judgment decisions for yourself and your employee and your family. And I think many of us recognize that when you lose control of that, whether it's your state government that then takes control or your federal government, which is even further away, the decisions may be more attenuated than what you are able to do with. I don't believe that we in the federal government should be running health care. I don't believe that we should be building automobiles. The government is good at some things. Now, don't ask me to tell you what they are right now. That's a completely different issue. But healthcare, and I think this is what has driven you out here today, is personal. It's oftentimes very emotional. And for us at the government level to impose more kind of one-size-fits-all standards, I don't think gives you the level of decision-making that you want, the ability to choose that you want for you and your family. So the direction that we're taking right now, I think we need to kind of pull back, revisit how we can make meaningful changes that don't cost this country and provide better health care for all Americans.
I have another comment from the folks outside. This is how will we prevent insurance companies from placing financial limitations or caps on how much they'll pay if we haven't been able to do that already?
If you haven't what?
Since we haven't been able to do that already, how can we actually do that with insurance companies?
Well, first of all, I want to acknowledge the people that are in the back of the room. I do hope that most of you are able to sit. I see some standing out there. The good news for you is the air is probably a little bit less stifling on the outside, so you may have had the better end of the deal. As far as how we kind of reckon with and deal with the insurance companies, I'll tell you, so many of the proposals that are out there, whether it's on the House side or on the Senate side, and what the President is talking about, many of these issues that relate to health insurance reform are reforms that the insurance companies are willing to take on. We're talking about the requirement that the pre-existing conditions, that you be able to, if you have lost a job and you've lost your insurance and you have to move to another insurance plan, you've got a pre-existing condition. I think there is a recognition that this is something that shall be addressed, will be addressed. It's not a Republican or a Democrat split on this. We agree that we need to deal with this. So that is one of the issues, and there are some of the others in the insurance reform area that I think we will see a bipartisan resolve on, and it's because the demand from the American public is such that we've got to. Why would you stick with your insurance? Why would you continue with a program that you don't know if they're going to say, well, okay, sorry, you have now. We've discovered a new lump, and so we're no longer going to be covering you. These are some of the reforms that, again, are areas where Republicans and Democrats are in agreement that we need to resolve.
Okay, in the back of the room, the lady with the green, I think it's a lady with the green shirt, has a hat on. Yes, thank you.
Hi, thank you, Lisa, for having this tonight. I just wanted to give my 2 cents, and I kind of feel like this plan, the president's, the House, and the Senate's all kind of reek of socialism. And I'm very afraid of that. And I see that it's trying to come in softly through the back door. And I just wanted to say that this is not the country that I want to live in if it goes to that. Thank you.
Your comment, again, is one that I have heard expressed, and it's not specific to this health care bill that we have in front of us. It's a concern about a drift that we may be seeing as a nation, and I think it should concern us.
Okay, over on this side of the room in the back, the gentleman with the hat in the back.
Can you wait for the mic?
Hold on just a minute. No, it's the gentleman back in the brown hat there. Thank you.
Darn it.
Hi, my name is Al Bowling, and I might be beating a dead horse to death. I'm kind of hard of hearing and haven't heard all the answers, but I do have something to say about the Medicare reimbursement rate. And if you're not on Medicare, just for your information, if your doctor charges you $1,000, Medicare will probably reimburse him possibly $250 for the payment. This is one of the reasons doctors are not seeing older patients on Medicare. I don't know what you're going to do about this, because if you increase the rate, then the amount of spending that the government office is going to go up. If you pass a law ordering them to see these patients, I have no idea what's going to happen. My other comment is that I kind of see this as we're driving along in our automobile, and up a road in ahead there's this big fog bank, and it's complicated by the Medicare payment system, by the poor people not having enough coverage, by rich people being able to get whatever they want. And I feel like we don't really know where we're going, and it's going to take a lot of working together on both sides of the aisle, from the Republicans and the Democrats, to find the solution to this problem. And I have not seen a lot of positive things come out from the Republican side, other than some negative comments. We don't want this, we don't want that. And I'd like to see more working together. We need it. It's going to take something like this to solve this.
Okay. And I agree wholeheartedly with you. It's going to take more working together. It's quite honestly, folks, it's going to take more time. This is complicated, this is complex stuff, and it's not just going to happen because I say that we have to have it by this date. Think about what we are dealing with here. This is, this is 1/6 of the nation's economy that we're talking about when we're talking about health care reform. This affects you whether you're Republican or Democrat, whether you're urban or rural, or live in Alaska or live in Maine. This crosses everything. So let's take the time to get it right. And if it takes us a few extra months, it takes us a few extra months. Now, you've mentioned that we need to be working together. This cannot be just a Democrat solution, because it's not just a Democrat problem. And it's not a Republican problem or a Republican solution. We have got to figure out how we address this issue that affects all Americans. And so we are very divided in the Congress right now. And in order to get to solutions that are workable solutions, we've got to figure out how we come together to have good discussion, good debate, and work through these issues. There's a couple good bills, I think, that are out there on the table that have been proffered by Republicans. There's a bill that Senator Wyden from Oregon and Senator Bennett from Utah have put out on the table a year ago. That particular one has 13 co-sponsors on it, pretty much even in terms of Republicans versus Democrats. There are things in it that, you know, I don't like, but is the meat of it something that we can be working off and talking off of? Yes, and this is where we need to be going, not necessarily saying it has to be this bill or it has to be this plan. We've got to be sitting down and we've got to be doing the hard work. There's six men and women in the Finance Committee that have said, I'm gonna hold off all the pressure that I'm getting from whether they're Republican leadership or the Democratic leadership or from the president, and they're saying, hey, we just got to plow through and work on this. Will they do it? I don't know. But I'm sure hoping that they have the collective will between those six to continue it, because I think Americans want a solution. They don't want to see the partisan bickering. They don't want to see the name calling, and they want to see solutions. And that's our job, is to deliver solutions that work for the country. I agree.
Okay, the lady sitting about the 6th row back with glasses has, this way, the 6th row back. Thank you.
Hi, my name is Lisa Terrell. Thank you for being here today, Senator. I have several questions. I'm a 44-year-old disabled person. I am on Social Security disability, therefore I am on Medicare. As the gentleman in the back stated and the family practice doctor over here stated, Medicare only pays between 2 and 20% of what the physicians bill. It's incredible. $1,200 bill, and they will pay $47 or less. In some cases, they pay nothing. That's the reason why our doctors are opting out of Medicare, and I don't blame them. As far as what you are saying that you will support about health care reform, I'd like to know who guarantees that I can even see a doctor. I'd also like to know who and how will it be decided whether my lifestyle is healthy and my behaviors are healthy, so that I will be rewarded for that by continuing to get health care. And as far as our small business employers, Hawaii, which I lived in for 12 years, is the only state with mandatory employer coverage. If your job is 20 hours a week or more, your employer must provide you with health care. What that's done in Hawaii is it's forced small businesses to hire twice the number of people and have them work only 19 hours a week, so that the small businesses do not have to pay for their health insurance. That's why most people in Hawaii work 3 jobs. Who is going to tell the employer how many hours a week a person has to work for them to pay for their health insurance?
Thank you for your comments.
Your good comments. Let me address the last one first in terms of what you experienced in Hawaii with part-time employees and an employer mandate. In the Senate Help Bill, there is a requirement that all employers who employ over 25 employees, they are required to have health care coverage offered to their employees. Failure to do so will result in a $750 per employee penalty. If you are a seasonal worker or a part-time worker, the penalty per employee is $350 per employee. So it goes back to, Tom, you said you were a small businessman. I don't know if you have more than 25 employees, but one of the concerns that we have is that if, in fact, you have this employer mandate with the penalties on it, as a small businessman, you may look at what it costs you to provide for that level of coverage, and you say, well, you know what? $750 as a penalty per employee, even though that's a tough hit, it may be less than what I would be providing for coverage for them as is. So I think I'm just going to stop offering my employer-based plan and let them go to a government option. So when there's discussion about a government option could ultimately result in a shift of some 88 million Americans from private insurance plans that they have had through their employer to a public plan, that's what we're talking about. Now, you ask an excellent question about, well, you say, Lisa, that in your list of strategies or things that you will support, that you want to know, well, who's going to guarantee that you get, I'm looking for the, guarantee that you get health care. Well, that's part of the problem. What is the guarantee here? And the guarantee as to, I mean, if you're an individual with disabilities and you have issues that, well, if you're okay, you're on Medicare, so maybe I shouldn't use you as a specific example. Let's go back to how do we guarantee that people get health care? What we might be able to do is guarantee that you have access to health care insurance. But it goes back to what was stated by Dr. Farr earlier, that if you don't have doctors that are seeing these individuals, if they're not going to take Medicare, if they're not going to be on the government plan, we have given you the bus ticket without the bus. We have guaranteed access, if you will, because we've said, okay, well, you now have insurance, but if we haven't fixed the other side of it, which is getting you in the door to see a provider to help you, how have we helped you? So again, to go back to building a system of reform on a system that has failed us here in Alaska with Medicare, and it goes back to the reimbursement issue, it's just not going to work. We won't be able to guarantee you health care. We might be able to guarantee you the card that says you can get there, but if you're living in the wrong spot.
Okay, the gentleman on the second row with the brown shirt, glasses.
Over here.
1 second.
Wait for the mic.
1 second. Okay. Two things. First thing is this line is pretty scary.
Which one are you looking at?
The curve of the Medi-Cal or Medicare growing.
Okay.
But it's nothing compared to the size of the federal government that's grown over this time.
That's true.
Okay? That's what's unsustainable. I don't want to see the federal government grow. I want to see it shrink. Another thing, thank you. I just went to technical school. I'm an aircraft mechanic for a major airline, and we have people from my company from all over the world. I was sitting next to a guy from England, and he had an emergency operation. He needed a hernia, and they said it was an emergency operation. I guess it was really bad. But they put him on a 6-month waiting list. 6-month waiting list. He had to hobble onto a plane the next day and fly to New York and got the operation the next day. What the, are we even thinking? The government is not going to be able to do this. Thank you.
I don't know that I need to take time to respond to you, because I'm not convinced that we want to go the way of the health systems in the United Kingdom or in Canada. When I went up to Fairbanks, I was went up to Fairbanks for the town hall meeting last week, and talked to a man whose family's got 6 members of his family that live in Canada. And he says, please don't use this as a model. He said, let me tell you about my uncle who had an issue, I believe it was with his knee. And he said they made him wait for like 6 months before, or no, excuse me, it was 4 years. It was a long time. And it obviously wasn't as pressing as this individual that you addressed. But they made him wait for 4 years. And it wasn't because there weren't the doctors or the providers to care for him. He said that they wanted him to wait until he hit 60 because they estimate that a knee is good for about 20 years and they didn't want to have to do 2 knees. Now that's not the kind of health care I want.
Okay, down in the front, the gentleman on the second row with the glasses. Yes, sir.
Okay, first of all, something we can all agree on, mortality is 100%, so nobody gets out of life alive. But other than that, why don't we just simply pay off the profit and bonus vultures who run this country's health care now, give them an average 3-year price of their stock in a credit for their income taxes or their capital gains taxes if it's a mutual fund or pension fund, buy all their stock and make health care and health care delivery profitless, non-profit, cooperative, mutually owned. I have USAA insurance for my home and my car, and I get returns of my premiums every year, and I have a SSA, subscriber savings account, which people at USAA will know what it's all about, of $5,400 that I could take with me if I cancel all my policies, but I'd never do it because it's such a great plan. My premiums have stayed level or gone up maybe 1% in the past 20 years, and I've got $5,400 in the bank, and I get a return of my premium dollar every year. That's what we need in health care. And I used to be a physician, but I quit because health reasons, and also because of Medicare and Medicaid and insurance reimbursement procedures and roadblocks. And I just couldn't take it anymore. And I'm sure there are a lot of physicians out there who would not mind a nonprofit, patient-oriented healthcare system funded by the dollars, the premium dollars of the patients. And I estimate that if you charge $4 a day for people who have nothing wrong with them, $6 a day for 50% of the people who have 1 or 2 problems, and $8 a day for people who have 3 or 4 problems, we could raise $657 billion
the time
a year.
is up. Thank you.
Well, and I'll just pick up on your comment about a co-op and a nonprofit entity. Again, that's something that is out there and subject for discussion. And is it reasonable that we're discussing it? Absolutely. Will it work? Who knows? But I think these are the types of things that we ought not be afraid to have out there on the table and give them due consideration. I'm sorry that you left the practice. We need more of you.
Thank you. Another question from the back, and this was actually a number of the cards had the same question, wanting to know about tort reform, and is that part of the discussion?
In my opinion, tort reform has got to be part of the discussion. It must be part of the discussion. You talk with the doctors out there. We've got one that's in family practice now. We had one that left the practice. All those that I have had an opportunity to speak with admit that there is defensive medicine that is being practiced every single day in all parts of the country where you have doctors. And it is because the fear of being sued, the medical malpractice and the liability. And so the doctor knows what it is that he or she should be doing, but because of the threat, they're just going to be extra careful, and they're just going to order just one more test, and just to be sure, when in fact, these men and women, these professionals have been trained, they know what they're doing, but the way our system works, we are the most litigious society in the world, and we put our providers in a box when we say, you know, you should have done that test, or you should have done that test. And so they are ordering perhaps unnecessary tests that costs all of us. So it must be part of the discussion. The estimates that are out there in terms of the cost to the healthcare system put it in the range of $100 billion. we have to be realistic that when if we're going to meaningfully address the ever-rising costs of health care, we have to look at tort reform as one of the issues. Now, it is not part of the bill that we have coming out of the Senate right now. It's not part of the House package of bills. I think it needs to be.
Okay, about 2/3 of the way back, a woman in an orange shirt, red hair, I think.
Well, you're pretty good at spotting them.
Why isn't it part? Why isn't it part of the discussion? And one little thing I want to add is this we-they mentality that you guys don't have to abide by the laws you pass. If you pass something, you better have to abide by it.
And I'm with you on that. I'm with you on that. We should not have our own special program. Right now, as a federal employee, I'm a member of the FEA, Federal Employees Health Benefits Program. But my program as a United States Senator is exactly the same as the 17,000 other federal employees that are here in the state of Alaska. But here's the deal. If we were to pass a government-run plan, a government option, I believe that we, the members of Congress and those who work for us, should also be part of that plan. There is no reason that we should not. That is part of the Senate bill. It came out of the Help Committee on a very narrow vote. I believe it was 12 to 11. And it was interesting how partisan it was. It's also interesting how partisan tort reform is. We can't seem to get our Democratic colleagues to come with us in agreeing that tort reform must be part of the equation. We got to work on that.
Okay, the gentleman on the side over there with the yellow shirt, standing up. Again, everyone, please introduce yourselves.
Hi, thank you very much. My name's Rob Barrett. I've been in the insurance business for 19 years. I have a stake in this discussion as a result of it. I have many of the people maybe in the audience as clients, so I want you to know that I'm here on behalf of my clients, not just of myself. That being said, there was a meeting that went on with Senator Hollis, I believe it was back in January or February, and he had a similar discussion. 90% of the room was people who were affiliated with the health insurance business, doctors and nurses, etc. And I'd made a suggestion at that point to him, and I think that tort reform is the huge part of this, but the litigious society that we are has definitely stepped up the pace for the cost of the health insurance to the people at large as a result of their increase in premiums. There's also the research and development that we pay for as a society that does not get passed back to us. It gets passed on to us as a cost item. So if we were to take the research and development that's done for the prescription medications that are necessary for everyone involved, especially our elderly now, that would be something to look at as far as a reform goes. We need to look at the manufacturers of the equipment that's used in the doctor's offices and make sure that that's positioned correctly on a cost basis so the doctors can afford to get it. The insurance that the doctors have to pay for has to be addressed. The cost of the buildings that they have to build. On and on, if you take it step by step, I think what we're doing is we're trying to look at a reform for health insurance, but we really need to look at the basic costs and drive those down. And one thing we're really missing is taking our children and offering them an education.
Thank you, sir. Your time is up.
In the medical field to help us out. Thank you.
The gentleman's touched on an interesting point here, and I was actually asked this morning at an editorial board meeting at the Anchorage Daily News. You know, what exactly are we talking about when we're talking about health care reform? And it's something that we need to better refine. Are we talking about reforming health care insurance? I think that's certainly one aspect of it. Do we need to reform Medicare so that it works in states like Alaska? Absolutely. Do we need to be reforming the delivery system and how for instance, how procedures are reimbursed? I mentioned at the outset we need to be working towards reimbursing for quality as opposed to quantity. We need to be looking to the medical home model where you have basically a full-on service, coordinated care. We can be looking to how we deliver our health care costs and thus reduce those costs. But these are all very different pockets. Health care insurance reform is perhaps different than what we need to do with Medicare reform, and is perhaps different than what we need to do with reform and restructuring of the delivery systems here. So again, this is very complicated. It is, as Mike Enzi, who is the ranking member on the Senate Help Committee, has said, he says, you know, every title of this health care bill that we have gone through could be its own standalone legislation. It's that detailed, it's that complex, and ladies and gentlemen, we've got to get it right. We owe it to you to get it right.
Okay, over on this side, the gentleman with the light blue shirt, glasses in the middle. Thank you.
My name is John, and thank you for being with us today. I appreciate that. It seems to me that basically it's a foregone conclusion that there's going to be some kind of bill eventually passed regarding health care. If we do the math, it seems that the Democrats already have the numbers to pass the bill without any Republican support. My question is, if we have a Medicare system that currently allows doctors to withdraw, to not be part of it, will the doctors still have that sort of an option if we have a federal government mandated health care system? And if they are allowed to withdraw, and we have the same thing happen with this new system as we have had happen with Medicare, what's going to happen?
That's my question.
Okay, in the very back, a gentleman, longer hair, glasses in the middle.
And I hope you don't take that as a flip response, because it's not, but I think it is a very legitimate question and we do not have the answer to it. The fact of the matter is that those providers would opt out. Okay, where were we?
Thank you, Senator. My name is Race Brunton. I am an uninsured American. I know you are aware, but I think many are not, that we already provide nationalized and not just single-payer national insurance, but national health care with government-employed doctors in the form of the IHS, the Indian Health Service. Even the U.S. Office of Management and Budget and federal agencies, which is usually critical of, say, the health offerings of the Department of Health and Human Services, generally gives the IHS a good rating, rating everything they do moderately effective or even fully effective, their top category. In fact, the only place where the IHS tends to fail is in provision of services to Native Americans and Alaskan Natives who leave tribal lands or reservations to find employment or education elsewhere, a problem that can really only be fixed by a nationally covering plan. I have two questions to you. Firstly, if we as Americans feel that the IHS service is good enough for people to whom we owe so much, people to whom we are making up for crimes that were committed against them, why is it not good enough for the rest of Americans to have government health service? And secondly, Senator, if we feel that it is necessary, that it is a moral duty incumbent upon us to provide this health service to these people as a restitution for the crimes committed against them, why do we not feel it is incumbent upon us to provide it to African Americans or to other formerly oppressed and persecuted groups who do not receive it? How is that not a form of institutionalized racism?
Let's talk about the IHS system, because we do have here in Anchorage, particularly with the Alaska Native Medical Center, I think we would agree it's a pretty first-rate facility, and I think we are proud of what they have been able to do. I've been on the Indian Affairs Committee since I got to the Senate and have had an opportunity to really spend some time understanding the IHS system, how it's working and now how it's not working. I will tell you that we chronically underfund IHS, which has led to, you want to talk about rationing of care, you go and you talk to some of those who live on the reservations in the lower 48, and pretty much if you have if you've injured yourself after, I think it's July, you're out of luck because the money is out in terms of what is available to be paid. It's a pretty dismal situation. So I think we look at IHS and say that it is a system that when allowed to work with the appropriate financial backing and support, it's okay. It's not a model of government efficiency, though. I'll speak to another form of government health care that we know a lot about here in this state, and that's the VA. And I can tell you, if you happen to be one of our country's veterans who happen to live in an area where you have access to VA services, that's good for you. But far too many of our Alaskan veterans, you know, whether they're not living on the road system, basically there is no access. So they are given the promise that they earned when they signed up to serve, that of health care, government-run health care, but only if they happen to live in the right place. So, you know, is that what we want to be doing? I had an email from a woman who said, I'm on Medicare, my husband is a vet. I can't get in to see a doctor, and my husband has been waiting for 3 months for the VA to finally sign off on a prescription drug that his doctor has ordered that he take, has prescribed that he take, but the VA can't decide whether or not this is something that they're going to be paying for. So we've got some issues with government-run systems, and again, if you're gonna go down that road, we better figure out how we do it right, whether it's standing by the obligation to American Indians and Alaska Natives or to our veterans.
Okay, the person in the middle, the green shirt, lady in the, yes, you're.
Hi, Lisa.
How are you?
Is Nancy here?
No.
Oh, okay.
Wrangle.
Okay. My point of talking is that I had something done to me directly. I had my cataracts removed, and they said that I needed the skin from the side of my eyes removed because I had no side vision. They sent me to gave me a list of some doctors. I took the first one, Dr. Dwight Ellerby at Alaska Regional. Went over there, saw him. He says, yes, we can fix that. I just pull up the muscles from my eyes, remove the skin on the side, pull the muscles up, and attach them to my skull. I went in for the operation, was unconscious while he was operating. He did 21 things wrong to me. I tried to get the insurance, Social Security insurance to not pay him. They paid him. And then I went to 34 attorneys, and they will not go against a doctor. Even outside, I went to lower 48 to get some doctors to pass judgment on the operation, and they called the doctor up here and said, sorry, they couldn't help me. Now, what we have here in Alaska is that they are working, the insurance companies, the medical malpractice there is no help for people who have medical malpractice. As far as the VA is concerned, I have a friend who was in the Air Force overseas and held prisoner, and she was being treated for post-traumatic stress disorder, and the VA here was treating her. Then they stopped and said she had to pay full payment because it was her choice.
On the issue of tort reform, I think there's many who are concerned that, well, if we were to institute some level of tort reform, the doctors who did act negligently or did commit malpractice, that somehow or other they skate free. And that is not what tort reform is about at all. It is not designed to let doctors fail in their practice. So again, it's making sure that the protection is there for the patient, while at the same time ensuring that we don't have a practice, if you will, of defensive medicine that unnecessarily costs people across this country.
The gentleman in the red shirt on the front row.
Hi, Senator. My name's Ed. I was wondering, how come, first of all, how come the Senate and the House can't get their act together and maybe put a higher tax to pay for our medicine from the imports we're getting in from communist countries? Why don't we give America back to America?
Well, I tell you, I'm not one that wants my health care shipped overseas. I'm not one that wants, I want to make sure that the drugs that I'm taking are safe and they're the drugs that my doctor believes that he has prescribed for me and that they are the medication that I need. You're talking about a bigger picture, which is keeping it local, bringing it home, and supporting Americans. That's a tough one to argue against.
Back out to the hall. There are a number of questions having to do with the provider shortage, with the shortage of physicians, nurse practitioners, physician's assistants, and other providers. And is there anything in the proposals that discusses that?
Well, in both the Senate bill and the House bill as well, there is a recognition that we do have a shortage of providers, and particularly in the primary care area. Some of the proposals that are out there are ways that we can incent individuals to go into the practice, whether it is payment of student loans so that they can be encouraged to come back. We need to do more to get more providers. And again, it's not just here in Alaska, but there's some 17 states across the country where right now there are simply not enough providers available to accept specifically those on Medicare. It's states like, in addition to Alaska, it's states like Oregon, Washington, Colorado, New Mexico. This is an issue that must be addressed, is how we deal with this as a national shortage. But it hurts us more perhaps markedly in rural places, and particularly a state like Alaska where we don't have our own medical school. We're not growing our own. And one of the things that we know is that typically an individual will end up practicing within about a 100-mile radius of where they have been trained, where they have established their residency. So we're kind of out of luck in terms of that. We're working with University of Washington. We're working, Providence has a training program, but our reality is that we are at a disadvantage. So we do have things in the legislation that does focus on incentives to encourage more to go into the practice. One of the things that I think we need to do is recognize that doesn't have to be just incentives to be a doctor. We need to have more mid-levels. We need to have the nurse practitioners. We need to have the PAs. We know here in Alaska that in so many of our communities, you're never going to have a doctor out there. But a nurse practitioner, that works great. A PA, that works great. So let's make sure that, again, when we're talking about reimbursements, that those mid-levels are covered as well. We need to do much more to encourage those to go into the primary care as opposed to the specialists. And right now, the incentives aren't there. When you talk to, say, a cardiologist about what they get reimbursed for procedure versus what a family care doc is going to get, you know, it's no wonder that people go into the specialties. We need to turn that on its head as well. There's a lot that we can do to provide for the appropriate incentives so that we get more practitioners, more providers out in the field.
Okay, the lady in the back, second row from the back on this side, on your left in the blue shirt.
Greetings, Senator Murkowski. I would like to make an observation rather than a comment or ask a question. It seems that as soon as the American public becomes familiar with what the definitions of like health care insurance reform stands for, you guys morph and change it to a different name, such as health insurance. Now, which is it? Is it health care, or is it health insurance, or is it health care insurance reform, and is it public option, or is it co-op? Which is it? Thank you, ma'am.
That, my friend, is the process, and it's difficult, though, to follow, and we're all kind of smiling and laughing, but she's right on. But right now, I think what you all need to understand is this is still a process, a legislative process. They describe it as sausage making, and that's probably an apt description of it. You don't want to see what goes into it, but you darn well want to know that the outcome is going to be good. But right now, we are still working on, you know, our definitions. Is it government option? Is it co-op? Is it not? We don't know. That's why I'm out here listening to you and getting your input.
Okay, over on this side. Yes, stand up.
We're making these guys get their exercise. So much for the prevention and wellness. It's not working. No.
Still not working.
No. Flip a button.
Hello?
Yeah, there you are.
Thank you, Senator, for coming, and thank you for having the courage to come here in person. I hear some of the senators across the country are doing it by teleconference. Anyways, I have a couple comments to make about what the definition I believe healthcare should be, health reform should be as well. I hear a lot about money and profit, and I want to remind you, we're talking about people's lives. We're talking about health. We're talking about our grandparents, our family members, our community. And profit and money is one thing, but we are talking about human beings. And the second thing is, along that lines, I think that profit and healthcare we're talking about are morally, should not be connected, period. They are not together. You cannot have profit associated with making the right decision all the time. And when you have profit associated and in part of your mind, you're never going to make the right decision. Maybe sometimes, but not always, and not when it really matters. And lastly, I want to ask you how you like your health care.
Well, I am fortunate. I have health care. I'm fortunate. I have health care, and as I said, it's the same health care that other federal employees around the state have. But the thing that's great about my health care, and I will say it's great here, I've got I've got a couple dozen plans that I can choose from. I've got more than a couple dozen. I've got a lot of plans that I can choose from. And so for me and my family, you know, this is what I think people want. I mean, when my kids were younger, you know, I wanted to make sure that we had something in the plan, whether it was able to put aside something in an HSA, or we were dealing with braces, and we were dealing with things that we planned for as a family. When my husband and I first got married, you know, we weren't making a lot of money between the two of us, but we wanted to make sure that we had coverage that provided for maternity benefits. And you know, so you just figure it out, and you spend more, far more on your health care than you want. But the point that I'm making here is that I have, as a federal employee, I've got choice within a suite of options that is offered to me. And I think that that's what people want with their health care. They want to have choice, and they want to be able to cater it, to streamline it to their needs and to their family's needs. And as you change, and as you grow, and as your family grows, you change your plans. And you want to have portability with that. You don't, how many people do you know that are stuck in a job that they don't like, but they don't dare leave because of the health insurance? They are stuck there, and that is wrong. So, you know, when we talk about those things that we must fix, that's one that we've got to fix.
Okay, over on this side, a gentleman with a blue shirt next to the lady in a red shirt. About, yeah, there.
Do you feel like you've won the lottery when he calls on you?
My name is Brendan Carpenter, and I too would like to thank you for showing up today. I appreciate that a great deal, to come and talk to us. I think it's also a kind of a neat thing that we as Alaskans can come together and we don't look like any other state, yelling, screaming, fighting, bickering. I'm a former Marine, so I like to keep things as simple as possible. My problem and my concerns with this plan is we've been told that our system is completely broken and destroyed, and we got to fix it right now, because I believe what you wrote is probably true, that 88% of Americans are satisfied with their current health care plan. Doesn't make sense to me that you can have that large of a number that have access to it, have it, and by these numbers that you put here, are happy with it or satisfied with it. Doesn't it seem more logical, easier to manage, and quicker to get done if we deal with those that don't, instead of trying to take such a large portion and say you can no longer have what you've worked for? I don't understand how, I'm only 40. I've got a wife and 2 kids. I go to work, I work as hard as I can. If I become rich, or what somebody says is rich, how do I then become a villain? Because I've worked to attain what my family needs. We can't continue to try and work both sides of the fence, pulling on both ends, and having a middle class that's torn between 2 sides. If we can deal with that percentage that isn't happy or can't get it or is struggling to get it, and leave us to have what we have, work for better, or continue to keep what we have, I don't understand how you can say that it's completely destroyed and we need to fix it right now.
Well, first of all, I thank you for your service. Second of all, I thank you for articulating what so much of our problem is. If you look to the chart that I've provided you in terms of the breakdown of the 47 million uninsured, I mean, we've been talking collectively as a Congress saying this is the group that we need to address. We need to be able to provide insurance. But again, I'll take you around that pie chart, and what you get down to is about 12 million, 13 million that are really those without affordable insurance options. They just don't have anywhere else to go. They're not eligible for Denali Kid Care or S-CHIP or Medicaid, and their employer doesn't offer a plan, and they are legal citizens here in this country, and they don't have the income that would allow them. So we are talking about 12 million. Well, 12 million is still a lot of people that we need to help address. But it is not something that, again, in order to address that need, you throw out everything else that is working for 177 million people. So here's the balance. Here's the balance and the challenge that we have before us. And that's not my statement about whether or not 89% of Americans have health coverage and 88% are satisfied with their current health plan. That's something that we took from the Time magazine poll and placed it there. It's not unlike what we're seeing with other statistics. There is great concern in this country that when we talk about health care reform, and you're trying to reform it for those who truly do not have options for affordable insurance. They really don't have it, but you and your family have been working hard and are satisfied with where you are, and the concern is, well, why are you messing with what I have? And this is this great tension that we're seeing around here, trying to figure out how we address those who are truly without messing it up for those that like where they are and want to continue with their current coverage. It's a very difficult issue.
Okay, about 10 rows back, young man in blue shirt.
Hello, thank you for coming today, Senator Murkowski. My question is, Senate Majority Leader Harry Reid and the Majority Whip, Dick Durbin, recently both stated that they would not be opposed to passing health care reform if they don't have the 60 votes necessary to bypass debate and bypass a filibuster, that they would pass it using a procedure that I don't really understand called budget reconciliation. And I'm wondering what you think about that and whether or not that would be a feasible solution if they don't have the votes. And I don't think that's a good idea for the record.
Okay. The process known as budget reconciliation is a procedural mechanism unique to the Senate that would allow for a way to get around a filibuster. Filibuster requires 60 to break it. When something is moved through reconciliation, it just requires 51 votes. So it is a process that is available. It is a process, however, that is subject to some technical rules within the Senate in terms of what may be considered under reconciliation. And without getting too much into the weeds, there's so much contained within the health care bill that came out of the Help Committee that would not be subject to reconciliation. For instance, the wellness and prevention pieces. What could be subject to reconciliation would be the tax piece. So here's the question to you. If you're a Democrat and you're saying, well, okay, we've got to move this plan because our leadership has directed that we should, if all you're going to be able to move is the tax piece without what most would consider the good things in the bill, which I absolutely believe that the prevention and wellness pieces are good and important and necessary, is that where you're going to be as a member representing your constituency? So I think the Republicans don't like it. I can tell you that for a fact. We feel that we need to be working together on a bipartisan bill and moving a bill that can get 70 or 80 members' support. But it is an option for the Democrats. They are in the majority, and they've got a sizable majority. They've got 60. So they've got some options that are available to them, but I don't know. I'm not in these other states during this August break. I'm here in Alaska. I'm listening to what Alaskans are telling me. If I were a representative from some of these other states where people are coming out in droves and are expressing their concern about this, you know, it's one thing to go ahead and follow your leader. It's another thing to be listening carefully to your constituents. So I think there's a dilemma out there.
Okay, about in the same position on this side, a young lady, black and blue. Not from any
No,
no, it's that one there. Thank you.
Hi, I'm a junior at Diamond. My name is Lauren. When we went to our war abroad, people weren't nearly as concerned with the huge amounts of money we were spending at war, at like hurting
Excuse me,
people.
can you just slow down
hear.
just a little bit?
Okay,
You've got
sorry.
time.
But now when like the healthcare is coming up,
you need to repeat.
Sorry. When we went to war abroad, people weren't nearly as concerned with the huge amounts of money we were spending at war, like with hurting people. But now in a healthcare reform bill that will help Americans with their health and their lives, money is now this huge issue. As a youth, who is going to have to pay off all this money, I'd rather pay off a debt where the money went to help people rather than killing them. Everyone keeps saying that the Americans are creating a huge debt for their kids that the kids are going to have to pay off. So why not ask us?
Thank you. Thank you.
And I appreciate you being here, and I appreciate your statement. I think we all need to be cognizant that what is happening within our federal government in terms of our level of spending, whether it is on the men and women that are serving us in Iraq and Afghanistan, whether it's on health care or whether it's on cash for clunkers. The fact of the matter is that that debt is passed on to you. And so the choices that we make and the issues that we advance, we darn well better make sure that we're doing right, and we're doing right by all Americans. I appreciate your input and your comments, and I wish we had more young people like you that were willing to stand up.
Okay, the woman up here, red shirt, about the 7th row back.
Oh my. Well, my speech has kind of changed. You've been very good to us all, but we are scared. We're scared of what this administration is doing to us. They're taking away a good republic and replacing it with a socialism, and we're scared to death. I'm imploring you to do all you can to scrap this health bill. Stand firm against cap and trade and stop card check. The unions have got too much control over this government already. Through our apathy, some say we deserve the government we have, and they might be right. But no more. The silent majority is speaking up with a roar. And we are not going to calm down. We won't calm down. When you go back to D.C., we're mad. I would like to see, I have appreciated everything you've talked to us about tonight, but so many concerns that we have, this green movement, this drill here, drill now. We're spending $10 billion in Brazil for them to drill, and they won't even let us drill in our own country. We're really mad.
Excuse me, we do need to stick to health care issues. Thank you.
I'm getting back to it. You work for us, you gotta fight for us. Tort reform is the first thing we need right now. That'll be the most done toward health care that anything you guys will come up with. And we need to stop illegal immigration. That will help health care too.
She's hit on too many issues, and I'm supposed to stick to health care, so I agree with you on tort reform, and that must be part of our solution here as we deal with health care reform.
Okay, the woman in the dark black sweater standing there, yes.
Thank you for taking my question, and welcome back home, Senator Murkowski. I
would like to express my gratitude for the young lady from Diamond High. Go Lynx. My daughter graduated in '91, so I'm very proud of her, and really appreciated her question. My question is actually, I actually have two. One is, what, do you have any idea what Senator Begich's ideas are on this issue? I'm just asking, has she at least talked to him and kind of try to find out what his ideas are on this issue? And I am a registered nurse, and I just got back from a seminar today on finding out what Medicare does and doesn't pay for on some of the things that I do as far as care for my patients. Now, I understand all this stuff about insurance and who pays for this and who does that and the whole business, but I guess my argument has and always will be, for me, patients come first. Now, as far as this whole business on health care is concerned, I have only one question, and that is how long is it going to take you to figure out how long it's going to take you to do this? We've had, no, I'm serious, I'm really serious. We've had President Clinton who tried to introduce it, and his wife kind of did a little something. We had Bush come in, and what, has this been what, like 16 years? Or, well, 8 and 8, what, 16? And we still haven't kind of come to some kind of reconciliation or some kind of idea of who's going to do what. And I just would like to know, what are we going to do? Where do you...
Time, thank you for your question. Okay, where are we
coming in?
Well, I'll tell you what I'm not going to do. I'm not going to sign on to some arbitrary date and say we must have it by this date. What we've got to do is set as a priority, we've got to get the best policy. And if that means that we focus on insurance reforms first, and then delivery systems, and then Medicare, I'm not quite sure that we need to say, well, this one has to go first chronologically, or we have to do them all together. What concerns me is that we say, well, it must be done by this date. And I will tell you, we had a conversation. 4 of us were invited over to the White House to talk to the president about what some of our ideas were. And I said to sign on to an arbitrary date is difficult. And he reminded us that, you know, we in Congress are not unlike your kids in school. We all respond better with a deadline. And he is right. He is right there. But you set an arbitrary date and you push it, and you get something that doesn't work for this country. We live with that for a long time, folks. And here's one thing. Somebody asked me this morning, they said, well, you know, it's just money. Well, it's not just money. The stimulus bill was just money. Healthcare reform is entirely different, and if we do what is proposed out of the HELP bill or what is proposed out of the House bill, it is reform. The last time we did really significant reform like this was back in 1965, and we've been living with that ever since. We've got to make sure that we get it right. And as far as my colleague, you're going to have to ask him for his specifics.
Okay, up here. Gentleman in the middle, about the 5th row back, white shirt.
I guess I should thank you for being here, Ms. Murkowski, first of all. But you know, my name's Paul, and I'm not scared. I'm really I'm pretty upset, quite frankly, and I want my old America back. I want my old values back. I want the families back. And here, and again, I want to be a free American. Now, I'm not a Republican, I'm not a Democrat, I'm a revolutionist, because that's what my forefathers did to establish this great country. And here's what the problem is. The problem is you and the other leaders. I've never seen such disconnected leadership in my entire life. The process, that's not a minute and a half yet.
Can you please, this is about health care reform, and,
yes,
and if that's a question. Okay.
Yes, it is.
Thank you.
And because you're limiting me to 2 minutes, I have to make a bigger, broader statement. The point is this, Ms. Murkowski, the process is broken. The process is broken. My question and statement is this: will you ask Begich and Young to join you in a 3-day, on-camera, live, agendized, where we can do probing and peppering and interrogative questioning? Because you people are not standing before us for accountability. And as long as we have this disconnect from accountability instead of popcorn moments, we're going nowhere. And anyway, thank you for the opportunity to make a comment. All right? Thank you.
We've got, we've lost a few people up front here, but when we started out this evening, we had about 690 people that were seated in this auditorium. I don't know how many we've got in the overflow. This is my small attempt here in Anchorage to reach out to hear from my constituents. I've done the same up in Fairbanks. We had about 600 people up there. We're going to be down on the peninsula next weekend, and I'm going to be up in the valley Friday, I believe it is. Not this Friday, the following Friday. We have to have a level of communication with our constituents. We fail to do that, we get disconnected, we get bumped out. That's the way it works. And you need to hold us accountable. I'm not afraid of accountability. If I am, I shouldn't be in this job. So let me stand before you and take the hard questions. I'm willing to do that. I think we need to have this level of discussion and debate. And I need to hear the ones that are angry and the ones that are just really saddened. This helps me as I formulate how I can best represent you back in Washington. So you don't need to offer any apologies for calling us out. Have at it.
Okay, the lady on the front with the pink.
Thank you, Senator. I'm glad you're here and welcome home. I'm a supporter of health insurance reform, and the reasons, and I seek your support in voting for a bill. I believe if there is no bill, there is no reform. And one of the things I'm very concerned about is if you lose your job, you lose your health insurance. If you keep your job and you get sick, you could run into a cap and not have health insurance take place. If you keep your job and you go and are healthy and go for preventive care, that's not covered by some health insurance companies. And if you actually get really sick, you might be able to not be covered at all because it costs too much money. These are issues that must be addressed, and it's my opinion that it must be addressed this year. The lady who said we've been waiting for 16 years for some kind of reform is correct. The insurance companies right now must be held accountable for the changes in public policy for providing additional health care coverage for all Americans, not just the uninsured.
And Jane, you've articulated so many of the issues that Alaskans, Americans are real concerned about when it comes to the health care. As far as doing something now, I don't need to tell you, I think you know that Congress has a short attention span. And I shouldn't be flip, but our reality is this is the moment, this is what we're working on right now. Last year, what was everybody in this country focused on? Energy, and what was happening with the high price of energy. What happens? The price of oil goes down, and all of a sudden everyone's happy again, and now there's no pressure for us to move on energy legislation. So health care is front and center. I believe that we must be working towards some kind of reform. And again, the devil is in the details here. Because I've already had one opportunity to vote against the Senate help bill. I don't think that that would help Alaska, and I don't think it would help the country. So I can't go down that road. But I am not one of those who says we just need to will this away. If we just wait it out, it'll go away, and we won't have to deal with it. It is not going to go away. And I take you back again to the graphs that you've all been presented with. That national and federal health expenditures curve is just going to keep going up. the Medicare curve in terms of where it goes is just going to keep going down. I don't think we have an option to just say, if we hold our breath long enough, the American public is going to forget about this. Now, the woman in the back made a very interesting point, though, and you've reiterated, Jane, the fact that it was 2 administrations ago, with the Clinton administration, the last time we really tackled it, and they cut it dead off, and we didn't pick it up again for many, many years. I don't know. I would be afraid of that scenario if we were to put 5 years between where we are now and say do nothing at all, and then wait out a couple more administrations. I'm one that believes that we've got a really tough job to do, but that's why you elected us to do it. It's not easy. We're not going to make everybody happy, but we cannot just say, well, if we wait this out, the American public is going to lose interest with it. Our constituents are going to die down about this, and we can move on to the next issue. I think we've got a responsibility here. It's very difficult. We're not going to make everybody happy, but I do believe that we must work towards some bipartisan product when it comes to health care.
Okay, so the time is upon us, and there are so many questions that have yet to be asked or statements made. Please fill out your cards and leave them. There will be staffers outside. We're not stopped yet, folks. I'm just telling you we're getting close. I want to reiterate what my Marine friend back there said. I had certain people that were warning about what could happen tonight with rancor in the room, and I want to thank all of you as my fellow Alaskans for keeping civil, for voicing your opinions, and hoping this poor volunteer on the stage keeps some sort of control. One last question that came from outside, and I think it's a good closing question, and there were about 4 or 5, is, at this point, what way would you be leaning on how is the best way to make sure we have more of the people in the United States covered with some sort of health, affordable health care?
So we're talking about access to care right now. And I will take us back to where we started this discussion this evening, that we can go ahead and we can promise you a card and say you're now covered. But if we haven't given you the care that you need, if you can't get in to see a doctor, we haven't helped you. So one of the places that I have to start representing a rural state like Alaska is I've got to make sure that the incentives are put in place for our providers, that they will have reimbursement that is reasonable and meaningful. Absolutely, it has to be there. And that we do more to incent individuals to enter the profession, to enter the primary care field, as opposed, again, to our specialists, get those into the areas that we need. Let's move towards some of the examples that we see are working in terms of access and in terms of reducing our costs, and this is the medical home model. We've got a great example of it here in Anchorage with South Central Foundation and what they've been able to do on a more national level. You've got clinics like the Mayo Clinic where it really is that whole approach. But again, what it comes down to from my perspective representing Alaskans is making sure that we have the providers to provide the care, because if all we have done is provided you with that insurance card, I haven't helped you. So that's where I think we've got to start first. With that, I thank you for your attention. I thank you for your input. Healthcare is so personal, and it can be so emotional because we all have our stories, and if it's not with you directly, it's with a family member, it's a coworker, And I think that's why we see the level of interest and angst over where we're going as a nation when it comes to health care. We've got a heavy lift. As I said, that's why you elected us to go back there and do it. We can't run from the tough issues. But the input that you have given, and there have been some good suggestions, I would ask, as a favor to me, there are forms that you can fill out. Ask me more questions. Go on my website. Please submit emails to me. Give me your ideas. Tell me your stories. This helps me, and you're helping me. Hopefully, will result in better outcomes for all of us back in Washington. So again, I thank you, and I thank you for being such a respectful audience, listening to one another and sharing your thoughts and concerns. Thank you very much. Thank you.
You're watching Public Affairs programming on C-SPAN. Up next, an update on Afghanistan's elections. That's from the Brookings Institution. After that, Virginia Congressman Jim Moran is joined by former DNC Chairman Howard Dean for a discussion on health care. And in case you missed it, Alaska Senator Lisa Murkowski holds a town hall meeting on health care in Anchorage.